When you think about businesses that are selling through the roof, like Skims or Allbirds, sure, you think about a great product, a cool brand, and great marketing. But an often overlooked secret is actually the businesses behind the business, making selling and for shoppers buying simple. For millions of businesses, that business is Shopify. It's home of Shop Pay, the #1 checkout in the world. You can use it to boost conversions up to 50%, meaning way less carts going abandoned and way more sales going through to checkout. Upgrade your business and get the same checkout Allbirds uses. Sign up for your $1 per month trial period at shopify.com/income, all lowercase. Go to shopify.com/income to upgrade your selling today. Shopify.com/income.
Hi everyone, I'm Deb Flashenberg. Welcome to Yoga, Birth, Babies, a podcast produced by Prenatal Yoga Center. We will be diving into everything prenatal yoga, birth, and baby related, hoping to inspire, educate, and empower you through your journey into motherhood. Thank you for listening.
Hi, I'm Deb Flashenberg, and I'm your host of Yoga Birth Babies. And today we're going to talk about stress and trauma and how it may impact your birth. And so I brought on maternal mental health specialist Jenkins to have this really important talk. We cover things like the common stressors of pregnancy, things that maybe you didn't even think about, hormonal changes and trauma and PMADs and this huge life transformation. And then we also go on to talk about trauma-informed care. That may be a kind of a buzzword you hear, but we're going to dive into what is trauma-informed care and really so many of us that carry trauma, and what does that even mean? And then how do you communicate with your care provider about getting the support that you will need during your birth that can take in consideration what we all bring to our birth and if there's some trauma there. Janine also talks about birth debriefing and birth maps and the role of the nervous system and dysregulation that may impact birth flow. And of course, prepping for birth, the education, the mental, the physical, so much in this conversation. And if you are currently pregnant or you're supporting somebody that will be going through a birth soon, this is the perfect conversation to feel that you're putting your best foot forward to have a birth that has you feeling really empowered after. Because one thing Janine and I talk about is the amount of people that walk out of their birth and may feel not so great about what happened. And what she and I both feel strongly about is if we can do the work prenatally, then there's going to be less people feeling birth trauma or falling into PMADs, perinatal mood and anxiety disorder. Both Janine and I talk about our own birth experiences and how we carried stuff that needed to be, both she and I carried stuff that needed to be worked out as we both headed into our subsequent pregnancies. And I don't think that's unusual. So I think it's a really important conversation. I'm really excited for you to hear this. Before we get to my conversation with Janine, I always love to give some updates about what's happening at Prenatal Yoga Center. So really the best way to check out our current schedule of our classes, our workshops, our teacher trainings, head to the website, prenatalyogacenter.com. There you're going to find, I do a monthly blog. I have some free videos. I've got a ton of resources, but you can really keep up with all the good stuff happening at PYC. By the time this airs, I would have finished I think of everything in school years, this year's teacher training. It has been amazing. I am so excited about all the new Prenatal Yoga Center teachers out there. So amazing that they're bringing it to their communities. We'll be diving into our postnatal online teacher training soon and then start it all up again in the fall. So you can check all that out again on our website, prenatalyogacenter.com. And I'm happy to say that many of you are really listening to me when I'm sincerely asking if you have an idea or a guest that you think would be perfect for Yoga Birth Babies, send them my way. We have an application they can fill out to be a podcast guest, or if you just have an idea, just email me, deb@prenatalyogacenter.com. I really want to hear your idea. And then I always have a favor for you. If you can please leave us a rating and review. It's going to help people find us. All right, that's enough from me. We're going to take a super quick break. And we come back, please enjoy my conversation about stress and trauma and how it impacts your birth with Janine Jenkins.
Whatever the occasion, effortless elegance is right this way. Because Hilton brings you new ways to stay courtesy of the Nomad London. And it doesn't stop at award-winning dining in a space draped in velvet and illuminated by vintage chandeliers. No, this day goes beyond with unparalleled personalized service and attentive hospitality. Oh, and did we mention the Nomad London can be booked using your Hilton Honors points at Hilton.com? Hilton, for the stay.
Hi, Janine. How are you?
I am so well. How are you?
I'm doing great. I am really excited to speak with you. Before we started the recording, I mentioned that I heard you speak in the Body Ready Method program, and I'm like, oh, I got to talk to this person. So I'm so excited. You have so much knowledge. I'm so excited to pick into your brain. So thank you for giving me a little bit of your time.
And thank you. I'm excited.
All right, so let's jump in with, if you can just tell me a little bit about yourself and how your own births shaped your passion for birth work and a little bit about the work that you do.
Yes, absolutely. So I'm Janine. I am a licensed mental health therapist. I always like to start off with that because I'm now being known for being a doula. And so I am an LPC first, and I'm also a doula, childbirth educator, and a mom, a wife as well. So I have two little ones. I have a 6-year-old son, and I have a now 9-month-old baby girl.
Oh, wow.
And that is my story. So my story getting into maternal health, maternal mental health really started with the birth of my son. He was an emergency C-section. So I gave birth to him at 37 and 1. And my life kind of just went in a little disarray with the unknowns and just all the things that I did not know would come up postpartum. So mentally, emotionally, and especially physically after having a C-section. And so that is really what led me into going down the rabbit hole of maternal mental health, because I needed it myself. And there was not much support out there, or the support that I could find. I was living in Dallas at the time, was very expensive. And I was very newly into my LPC, and just money was not just there for us to be spending thousands of dollars to have and find this support. And so that is where my birth work journey actually started. I walked down the road of mental health, and I started supporting moms in my therapy room. And that was my specialty. I worked with birth trauma, and I worked with infant child loss, as well as just the normal PMADs, so perinatal mood and anxiety disorders. That was what my office was configured with. And so I absolutely enjoyed working with moms. There was not a day that I went into my office where I was dreading it. It was amazing. But then I started to feel, after doing that for a couple of years, I started to notice patterns. And a lot of those patterns was what I would consider to be psychological birth trauma, not so much as physical birth trauma. And I was kind of like, you know what? I think if this mom would have just done some education, or just kind of known her rights, or understood more about the process of birth, she may not have been in my office for this issue. And that is where I went down the another whole rabbit hole of birth work. And I became a doula and a childbirth educator. And I also teach childbirth hypnosis. So it's just, I do several things, and everything adds up. My biggest vision is to decrease birth trauma and decrease PMADs. And so all of the birth work, all of the doula work that I do is truly to keep women out of the therapy room postpartum, prenatally, as much as I can for issues that I know can be preventative. So that's a little bit about me.
That's a great mission. I support that mission. I mean, honestly, I can so relate to that. One of the things at Prenatal Yoga Center, my own first birth was really, it wasn't as much mentally traumatic as physically. It was just so long, which was mentally draining. And then I felt shell shocked after. And after that point, I'm like, no, we can't have people do this. Like, I need to figure out why this was so long in my body and that other people will not have this. So
Absolutely.
I think so many of us are on that mission because so much trauma happens. I mean, if you don't, I'm kind of throwing this random things. I don't know if you know the stats, but the PMAD rate, isn't it like 1 in 5 or 1 in 3? Like something
it is
very high.
It depends on where where we are, but here in the U.S., it's definitely 1 in 5 for sure. I definitely also believe it is 1 in 3 here too, but we just got to get some, more data in. But
that's what I have a friend that works at the Motherhood Center here, and she said it's 1 in 5 that's recorded, but she believes it's 1 in 3 because not everything's reported and recorded. And like, that makes a lot of sense. So knowing that the PMADs rate is so high, we need to do something. So I'm so glad so many of us are on a mission to try to help that, because starting parenthood from that place of depletion can be really challenging.
Yes, very. Absolutely.
So let's talk about, this is going to be more about pregnancy and how stress and trauma can impact birth, but things that we can recognize prenatally to hopefully help a smoother path. So what are some of the common stressors of pregnancy that you tend to see within the perinatal community?
Sure. So with my experience, some of the stressors that I see often are fear and anxiety.
Mm-hmm.
That can come right after people find out they're pregnant. It can be a very exciting time, and then a couple weeks later, they are full of fear and full of anxiety. We also see a lot of just PMADs. One thing that we know is if a mom or a birthing person has already dealt with anxiety, depression, there's already a diagnosis on file for them that they're working through, then they're going to be highly more likely to deal with that particular diagnosis or PMAD postpartum as well.
Mm-hmm.
And so that is a common stressor because some moms are taking medication for these disorders, and they may not be able to continue that medication. And if they're taken off of it, that is a huge stressor if there is no resource or nothing to combat what they've already been taken to help with those emotions. So that's a huge stressor that I find in my work, because I get a lot of referrals from doctors who, are seeing parents, moms that are on medication, and they
Can I have a follow-up question
support
about medication? And this might be outside your wheelhouse, so just let me know.
Okay, I can try to answer.
Okay,
yes.
yeah. So tell be like, nope, not my thing. So if someone is, and I know there are certain medications, I actually just did a birth story where this came up about medications, and she went off and realized that was a mistake and went on a different one for her second pregnancy. But if someone is trying to conceive and they're on a certain medication for mood stabilizing, should they have a conversation with their provider? It's usually a psychiatrist, not necessarily their general practitioner, that they are trying to conceive, and then to try to change medications to what is more compatible with compatible with pregnancy, because I know some are not recommended.
Absolutely. I know that is the most important thing. I believe that sometimes we're fighting uphill because, a lot of us don't know that we're trying to have a baby.
That's true. That's true. Sometimes it's a surprise.
It's a surprise, right? And then you're trying to figure out, okay, what do I do? What can I do? So yes, the first thing is going to be talking to your team, your OB. Sometimes it is the PCP in rural areas, And oftentimes I would also say, Deb, that you need to do some research on your team because we want someone who understands these issues, right?
Right.
There are psychiatrists I know in our area who will not work with pregnant moms
Oh,
because
wow.
it's not their area, and they know how, that they know that that's an important time frame for babies, for moms. But we do have a few here that will. And I think that it's important, just like as a therapist, as a doula, to know your wheelhouse and to know what you're capable of working with. And so I do commend the ones that are like, no, but you can go and see this person
Mm-hmm.
because they deal more with the perinatal population. And so the first thing that I would definitely do is, one, talk with your team, but also do your own research, because we definitely want to know what the risk benefit is of certain medications. And there are some medications where you are going to need to most likely stop.
Mm.
Um, and then there are some that are, safe for you to continue. But I do believe that if you're on any kind of medications, because even not your mental health meds, there are other meds out there, even allergy medications, that can affect your postpartum journey or affect what's going on in utero during your pregnancy. So I believe that there's some education that needs to be had no matter what types of medications you are, but especially your mental health medications. Yes,
That's important. Thank you. Yeah. Because I would hate
absolutely.
someone to find out they're pregnant and then just take it upon themselves. Be like, shouldn't be on medication. And then I can imagine the emotional crash or even maybe hormonal crash. I mean, the hormones are changing
Absolutely.
so much that can be a stressor too. Sorry, I'm going to throw it back to you. So
Yes.
what are some of these other pregnancy stressors that people should be aware of?
So, okay, so we talked about our fear or anxiety. I
Mhm.
definitely PMADs. So, if they're coming in with anything from the past, support. And I know support is so important.
Mhm.
And so, lack of support, whether that's from, I live in a military town, and so there is a lack of support here. So, we have to learn how to find community, and that may not be everyone's skill set. And
Mm.
so, I know lack of support is huge, prenatally and postpartum. We look at a lot of relationship struggles as stressors too. Um, Pregnancy can be a great thing, and sometimes pregnancy can highlight a lot of our issues that we didn't even know we had in our relationship. And so, relationship struggles are huge, along with body image, physical changes that are happening during your pregnancy, postpartum. As women, I'm sure you dealt with this within your community as well, but body image is huge.
Yeah.
As a 9-month postpartum mom myself right now, I'm having to talk to myself very nicely and very calmly, because I can look at myself and be like, that's not what you looked like 2 years ago. And so body image is really important. And I think that is something we should hone in on, because can be a huge stressor for moms, prenatally and postpartum especially. And then, of course, birth trauma.
Yeah.
So if a birthing person has had a traumatic experience prior to this particular pregnancy, that is going to be raining and ringing very loudly for moms, especially if there has been no type of work or debriefing between pregnancies. And any other medical challenges, I think, are always going to be stressors too, depending on what's going on with them medically.
Yeah, no, this is great. So people can really start to hear that and recognize maybe they might not even realize that, oh, that is a stressor. It could be so part of their day and life
Absolutely.
that they haven't stepped back and be like, oh, I do have stress that can
Mhm.
affect. And we'll talk about later how that affects the nervous system. But thank you for that list. I love lists. I feel like we really can then think about each one. So you mentioned trauma and birth trauma.
Absolutely.
So let's talk a little bit about trauma informed care. I feel like sometimes
Mhm.
that's a buzzword and people don't actually know what that means. So let's
Yes.
dive into what is it and how does it apply to birth? Because we
Yes.
talk a lot about that in yoga, trauma informed words and yoga, but I would love to hear how we can apply it to birth.
Yes. So when I think of trauma informed care, which is the approach and the lens that I come from with all of my work, it's understanding just how widespread trauma is and how widespread the impact of trauma can be. And so when we are looking from a trauma informed lens, we're prioritizing safety with this birthing person, trust and empowerment. And for me that comes through all works. So that comes from me as their doula or as their therapist. My hope is that that is coming from their OB, their birth team, those nurses, the midwife, even if they have a wonderful yoga teacher, whatever and whomever they are working with, my hope is that they are coming from a trauma informed care lens and understanding that we don't know this person. We don't know, we're not doing assessments on everybody that we talk to or that we encounter. And so I'm coming in as a trauma informed therapist doula for everyone. I'm looking at the safety, the empowerment, the trust with any encounter with this family that I work with. And so to me, that is the very first important piece, is that we understand what trauma informed care is and how we can actually utilize it in our own lenses as our work the work that we do.
So if someone's listening to this, like, that is important, that speaks to me, I need that kind of care.
Yes.
How do they speak to their care provider that may or may not practice that way, but to share, this is how I'm going to best respond? Because I can imagine that may not necessarily land well, but if they need that for their nervous system to function well, we need that for birth. How do you suggest they talk to their care provider about that?
Ooh, that's a good question. I would say first you have to know yourself. I think you have to understand and do your own work to know what you need, right?
Good answer.
If there is some form of trauma that has occurred in the past for you, then you need to know what you need in order for you to feel safe. If that is your doctor giving you really direct answers and not leaving feeling more confused than you came in, if that is for you to not be touched in certain ways, you need to know those triggers for yourself so that you can then explain those to your doctor, your nurse team, whatever, whomever it is that you encounter. And so a lot of times, we may not completely, our families may not even know their triggers. They may not even know or have done that type of work to know those things about themselves. And so I would highly encourage seeking out some form of support, whether that be a trauma informed doula, a therapist that works within the birth working world, prenatal, postpartum yoga instructors, chiros, anyone that can help you learn those things about yourself. I know with what I do, I give my clients a lot of questions. I teach them how to formulate questions to go in and then ask their doctors. That's really one of my favorite things to do, because, like you're saying, a lot of doctors that I encounter may not look at their work or the work that they do with their patients in a trauma informed lens, right?
Mm-hmm.
I think we're getting there. I think there's a lot of work happening currently in our world right now to get there. But I think they're looking through, the medical lens, and we have to help them and teach them how to work with us, work with women that have gone through trauma, or work with women who need a different type of care. So
yeah,
that was a long-winded question.
I love that. And again, I'm just wondering, and I'm literally just throwing this at you. If you happen to have any sense of how many people do we think, this is a big question, if we were to characterize like we did PMADs 1 and 5, what do we think that might be for those that carry trauma? I feel like, is it everyone?
Oh,
I mean,
oh my gosh. What kind of trauma, right?
I know. I guess I'm thinking about those that can head into birth carrying that. It makes me think of a birth I did many, many years ago. And the client really knew herself, and and I think she had vulvodynia. So she was really sensitive to touch. And the care provider was just so beautifully attuned to that and was just saying like everything, okay, with your permission, she just was really
Yes.
informative and delicate and took her time, asked permission,
Mhm.
waited for the consent, talked her through everything she was doing, did minimal vaginal exams, like barely touched her during the delivery. But I feel like that's few and far between. So how do we feel like this? How would, I guess, like you said, someone has to know themselves
Yeah.
and then communicate that with their team. But I'm also imagining a lot of people may not know that until they're in the moment and then get
Abs-
almost re-traumatized.
That's right. I mean, I believe all of us come with something, right? And my trauma, I always say trauma is in the eye of the beholder because it is, and I would venture to honestly say, Deb, that my outlook is I treat everyone with trauma informed care until I know their story and I know how to treat them, right? Specifically. And I think that can hold true for so many of us because
Hmm.
as a therapist, I would say we all come with something. We
Yeah.
are all coming in. It may not be physical abuse, but it might be something emotional that has happened, right?
Right.
And so we're all coming in with something. And I love what you said. I was smiling from ear to ear when you were talking about that previous birth because I know exactly what that room feels like. I just recently was in one and it makes the world of difference when the provider is is gentle, listens and knows, or doesn't know and is curious, right? To what that birthing person, what that mom needs.
Hmm.
And I've seen it play out several times with a few doctors in our area. And it's beautiful. It makes, I'm like, this is one less person that's going to be in the
Yes.
therapy room for this, right?
Yes.
And it's all because of that physician and all because of that person, that mom being able to advocate and share her story with her provider in her prenatal sessions, or just being able to say, hey, I don't want to be touched that way, or I would like this, or I would like that. And the provider actually listening. So I believe it can definitely be a beautiful thing when we're all collectively working together.
And I like to think that the medical community, again, not in any way bad mouth the medical community,
Yeah.
that they all approach birth this way. Because I remember doing a spinning babies workshop. Gosh,
Mhm.
this was like maybe 5 years ago, 4 or 5 years ago. And I actually thought there'd be a lot of people in the movement world. I was actually the only yoga teacher, and they were all labor and delivery nurses, which was also
Yes.
really, at first I'm like, oh, this is good. We need this. We need this. But one of them was so brave in saying something because we were talking a lot about informed consent and touch and looking at your client or patient. And this one labor and delivery nurse was really vulnerable in saying, wow, I really have a different perspective because I would walk in the room and I wouldn't necessarily, and this is brave, she said, I wouldn't necessarily see a person. I would see the job I need to do and touch that person because I need to move the monitor, or put the IV in, or check something without asking permission. She's like, now I have a different perspective. And I'm like, that is amazing that now she's
Yes.
going to do that. But at the same time, wow, that
Mhm.
the fact that she didn't think of that until this workshop makes me think how many
Mhm.
bodies she touched, again, without meaning to cause harm. But if
Yeah,
someone has that trauma experience, which many of us do, that in itself, we're again not meaning to at all, just doing our job, could have created more harm in the birth situation.
absolutely.
All right, so
Absolutely.
we're going to take a quick break. When we come back, because this I think is going to help us understand advocating and helping with stress and trauma. Let's talk about birth debriefing and birth maps. All right, we'll take a quick break. We'll be right back.
Summer's here, and you can now get almost anything you need for your sunny days delivered with Uber Eats. What do we mean by almost? Well, you can't get a well-groomed lawn delivered, but you can get a chicken parmesan delivered. A cabana? That's a no. But a banana? That's a yes. A nice tan? Sorry, nope. But a box fan? Happily yes. A day of sunshine? No. A box of fine wines? Yes. Uber Eats can definitely get you that. Get almost anything delivered with Uber Eats. Order now. Alcohol in select markets. Product availability may vary by region. See app for details.
The new McCrispy Strip is here. Dip approved by ketchup, tangy barbecue, honey mustard, Sprite, McFlurry, Big Mac sauce, double dipped in buffalo and ranch, more ranch, and creamy chili McCrispy Strip Dip. Now at McDonald's. Ba-da-ba-ba-ba.
Okay, we are back. So I would love for you to share about birth debriefing and birth maps.
Yes. Doesn't matter how we start, where we start.
You just start with however you want to jump in. The mic is yours.
Yeah, absolutely. So, birth debriefing. I'll start there because I'm actually on week 2 of a group for birth debriefing right now. This was something that I found to be very profound when I was doing a lot of research about birth and the postpartum journey. So my goal with birth debriefing is to have a very non-judgmental space for whether it's my doula client or like I have a group right now of about 5 moms that are meeting to just share their perspective. I believe everyone needs a space to get out their birth story. And it's so powerful to hear their birth stories or in their perspective of how things happened. And this is really what led me into more of my doula work, is hearing the birth stories of my clients and wanting to help them put pieces together, find clarity in their story so that they can heal and they can move forward and thrive and not be in a stuck place, right? And so with birth debriefing, I like for that to happen within the first 6 weeks, I say 2 months after having a baby. We know that it's very, evidence shows that having a birth debriefing between week 2 and week 6 can be very effective for moms. And so I just leave it open for the first 2 months for moms to come in, families to come in and actually debrief their births. But it's where they're going to find support. Again, it's a non-judgmental place. And we want to resolve, if possible, those unresolved emotions that may still keep them up, especially early postpartum, that are still keeping them up. Those questions that they may have that they may not be able to ask their doctor until their 6-week appointment, that's kind of ruminating in their minds. Any trauma that may have occurred during that time or during that birthing experience, we want a place for them to get that out. Because if it's not out, it's in. Mm-hmm. And we know that that could affect so many other things that are happening in that very, intricate early postpartum journey. And so in a birth debriefing, I have it actually set up into a 6-week type of session where we debrief different parts of their birthing experience, and they're able to share their story. They're able to come in and write a letter to themselves and talk about the unexpected things that may have happened and how they viewed it. And we get a lot of clarity. And it may not be that we are getting answers from physicians or we're getting answers, those stone like hard, this is what happened, this is why it happened. But my families are able to actually make sense of things. And that's so healing and so important during that postpartum period. Especially
I would think it's also healing for should someone choose to have another birth to have worked through. Because I know of my own, I had a lot to work through because my first one was so long that when I was pregnant with my second, my midwife, who I had the same midwife, we just sat and I had a very good cry about what if it's the same way again? Like I carried that fear of, I don't know if I can repeat it. It was so hard. And then the healing from such a long birth was so hard. And I really had to process it during that second pregnancy when I probably should have processed it before. So.
Absolutely. And that's what I see often when I have moms that come to me for birth work as a doula. They're not just normally coming to me because they just want a doula. they're coming to Janine because they know that she's a trauma-informed care doula and she specializes in this area. And normally in our first prenatal session, we are talking about the previous birth and we are debriefing the previous birth. And so what you're saying is so, so, so true, so normal. And it's really what I'm trying to work hard, because how long have you been carrying that burden, right? For me, it was, for almost 4 years before I was like, okay, I think we could do this again, you know? I always share the story of when I knew it was time for me to get help after my first child. Every time I would see a pregnant person or a pregnant belly, I would say, oh man, that sucks for her. And I meant it. I mean, I wouldn't share it out loud, but in my head, that is what I felt. I was like, oh my gosh, I know she's having a hard time. And not until, a few months after me kind of carrying that sentiment about all pregnant people, was I like, Janine, that is not right. People are supposed to enjoy their pregnancy. I think we need to kind of get some help to talk through some of these things, right? Because that's not the feeling that everybody has when they're pregnant. And if we are feeling that way, that means we need to talk through why we're feeling that way.
Oh,
And
I so appreciate you sharing that. I don't think you're the only one. So I really appreciate you, because I had something similar that I'm like, oh, you just need to get to the other side. Like, because and I know that's not the nicest, but I was like, just get to the other side. You'll be just like, and that's not necessarily what we should all be thinking when we see. And I was working with pregnant people. I'm like, oh, you don't know what's ahead. Like it took me some time to get past that.
Absolutely. Same. And so when we do a birth debriefing, and why it's so near and dear to me is because I do not believe, and I don't want women carrying those births with them, in any kind of birth. It doesn't matter if everything went perfect, in your eyes. Like, let's talk about it. Let's talk about what was so good about it. Let's talk about your strong moments, right? Let's talk about that support and what made them just so wonderful for you. Let's talk through these things. And so a birth debriefing is for everyone. And especially those that have those questions and those things that are still ruminating within them, those emotions. I want to see you so bad.
So then
I want to see
what's birth maps?
Oh, yes. So
I'm guessing that's like birth plans, but more. Yes. I think if it's like birth plan ABCD, like we can't go on gripping A. We have to bring a loose leaf of birth options. I'm guessing that's what birth maps are.
It absolutely is, because we are trauma informed, right? And we work out of the trauma informed lens. And so birth mapping is from Catherine Bell. And I went through a training with her, and it was amazing. It was just what I needed. We planned for everything. And so every one of my clients, we all do a birth map. And on that birth map, we have talked about spontaneous birth. So birth that starts at target, birth that starts in the middle of the night. We have a plan from start to finish of what we're going to do. We talk about an induction, because whether or not we want an induction, in the climate that we live in, especially in my area, it happens more than it should. And so, and it may not just be you going in for an induction, but them using some form of an induction process. And so we have a plan for induction. We have a plan for cesarean as well. And so all of my moms and families have a birth map. And they can answer, because of the education that we go through, they can answer and advocate for themselves at any point, right? And that is what keeps them out of my therapy room, because they had no idea that they would need Pitocin, or they had no idea that, they would have to have an induction due to X, Y, and Z, and they didn't know what was happening during the induction process. And, it's all those things that cause anxiety because of the unknowns. With the birth map approach, there really are not too many unknowns, right? And we talk about even the things that may feel icky. We talk about the cesarean. No, that's not on your plan. No, that's not what you want. And we're still going to talk about it and have a plan for that as well, because that is what trauma informed care is. We want to go through all the pathways. And you know, like I know as a former doula, a C-section is not always planned, right?
Yeah.
And one thing that we know about birth is that birth is unpredictable. And so when things happen and we need to get to the OR, the last thing that I would want a family to be doing is stressing out because they don't, not only is something happening, but they don't know what's happening. Things are above their head right now because they didn't plan for a cesarean. And so I want them to know their rights within a C-section. I want them to know, what's happening during that time, what they can still ask for, what their support people in person can still do and can't do. We plan for all of that. And that is what a birth map is. And it is one of the most, in my birth debriefing group right now, I have 3 moms that I actually attended in February that are in this group. And they had 3 different births. All of them had literally 3 different births. Okay. And they each were able to say Friday, I knew what I was doing. Even the one that ended in OR, she was like, it was the best choice for me. And I know we had tried everything else and that was what we needed to be. And I was literally crying Friday. I was like, y'all, I'm not supposed to be crying, but I was, because that's why I do this work. Right.
I love this. It reminds me of a study, and I'm not going to be able to date when it was because I write blogs and I've been doing it for like the last 18 years. So it's somewhere in the last 18 years. I saw a study about those that have taken childbirth education are less likely to feel dissatisfied with their birth, whether it went the way they had expected it or not, because they were able to make informed decisions. So
Absolutely.
that sounds exactly like what we're speaking about here is the education, recognizing, okay, it's probably not going to go my first choice necessarily, but if things have to be decided upon, I could be a voice in that
Absolutely.
decision making. I understand it. I've had education. I've put time into this. And
That's right.
therefore, it's not just happening to me, it's happening with my understanding and consent.
Absolutely. Absolutely.
Oh, I love that. All right. So that kind of reminds me of the nervous system, because when things are scattered around like a tornado and people are like, we're doing this, we're doing this, and we're doing this, and you don't understand what it is, or you're not part of the conversation, or it's not even being presented, I can imagine how dysregulating that is. It's like,
Absolutely.
yeah. So, and that, as we know, not the ideal place for birth when one is
Right.
dysregulated and chaos. So can you talk a
Absolutely.
little bit about the nervous system dysregulation and how it may impact birth flow? I don't even say like if, I'm like how it
How
will.
Absolutely. Because we know, as far as in our birthing bodies during that laboring time, that if we're dysregulated, our body is in that survival state and things just don't happen, right? When it's that time, or it's completely slows our birthing time down. And so what causes dysregulation, or what can cause dysregulation during a birthing time, could be fear, right? Fear or anxiety. I think there is, it's okay to have a little anxiety, but that's where those skills come in at, with learning how to put your body back into its parasympathetic nervous system and that rest and digest. Tap into that so that we can get back to work again. But when we're dysregulated, we might feel unsupported. We can be nervous about being in the hospital setting, or just honestly nervous about having a baby. That is something, to have a little anxiety about, especially if it's your first time doing it. And so sometimes I don't necessarily fault moms for being dysregulated. My goal is to teach them how to regulate their nervous system, because we all come in with a little dysregulation at times. And so when we talk about the nervous system, we always kind of start with the sympathetic nervous system. which is that fight, flight, freeze, or fawn. I love talking about fawning because oftentimes birthing people in the prenatal appointments, we can find ourselves fawning as well, where that might sound like your doctor telling you the a process about Pitocin. Let's just throw that out there. We're going to start Pitocin at this point. We'll give it to you every now and again. Is that okay with you? And in your mind, you will be saying like, I don't even want Pitocin. I know I don't want Pitocin. Like, why do I even have to have Pitocin? And outside, verbally, you might say, okay, right? And there's an internal struggle going on because you're screaming on the inside, but on the outside, you're saying, okay, and going along with it. So that is us being in that fight, flight, freeze, fawn state. And that's your sympathetic nervous system. During that time, labor can slow down. It activates cortisol, not necessarily oxytocin, which then, that normally kind of leads to those interventions possibly happening. It can also increase pain and cause more tension in the body, which is the complete opposite of what we want happening too. And so the goal of our birthing time is to tap into that parasympathetic nervous system, that rest, that digest, where we feel safe in that state, where we are able to actually bring on and support the oxytocin production happening. Where we're able to actually relax and our cervix can open and soften as it should and as it can. And we know about the labor flow, but we're encouraging more of that smooth flow of labor, right? Staying in that labor flow when we tap into that parasympathetic nervous system. So that's a little bit about the nervous system.
And it's so, so important. And I talk to my students about finding a way to downregulate, not just in birth, but I think also when that baby comes and they might be overwhelmed, like having the tools for parenthood. I think a lot of the tools that we talk about for birth translates very well to the overwhelm of parenthood. Thank you for sharing that. So let's talk a little bit about birth preps. We talked about education. What else do you want to talk about for prepping pregnant folks for their birth ahead?
Physical prep. I think you and I both know how important.
So important.
Preparation is. Yes, we can prep our mind, but we have to also prep our body too, so that we can be putting the best foot forward, right? Mm-hmm. I love how Lindsay from Body Ready Method says we're stacking the cards in our favor. Yeah. Mm-hmm. We don't know necessarily what will be pulled from the stack, but I know that if I'm doing my best to prep my body, prep my mind, prep my, support and have everything going well, then I'm putting my best foot forward and I'm stacking all those cards how I want them. So when I get a new client, one of the things that we definitely do is we talk through emotional, support and what that looks like for them, and talk through all of our trauma-informed information and how we're going to get the birth process and make their birth vision, or really perinatal vision, work for them. And we also, and I stress the importance of body preparation. So to me, that is a team. You need a full team for birth prep. You need your yoga instructor. You need your chiropractor. You need your massage therapist. I had an amazing massage therapist. She was amazing. And she was so important to my prep for a birth because I needed to be able to relax in order to have that VBAC. I needed her this last go around. So she was super important for me. And you also, I have a few moms that do acupuncture. And I am finding that there are so many benefits in acupuncture. It kind of makes me wish I would have known the acupuncture therapist here in our area during my pregnancy. But you definitely need that birth prep. So, of course, I always encourage moms to, there are many people and programs out there that focus on birth preparation, but really doing your research and finding what works for you And of course, I always say body ready method, but there are also the others out there that may be free. I'm not saying that they might be the best or not so well, but I always endorse BRM because
I'm going to say anything of that. Learning how to have internal balance. I know that Lindsay has that for Body Ready Method. That is what we've been teaching at Prenatal Yoga Center. When things are balanced internally, we take away the tensions and the potential stalls that baby might meet.
Absolutely.
So all the different programs out there that focus on body balance.
Absolutely.
I think, and I'm going to throw pelvic floor physical therapist in there because that is a place, if we're having anxiety and tension, a lot of times it shows up in the pelvic floor too. And we know that can be a labor stall. So I'm just so appreciative that you're really focusing on the whole person. So the mind, because we know fear can stall things out. So really looking at the whole prep, the education, the mental prep, the physical prep, and then the team that can support that. I call it circling the wagons, when you have your team really holding the space. Because that's, again, we don't know how it's going to turn out, but we can, as Lindsay says, stack the cards in your deck, in your favor, just trying to put the best foot forward. So, I love this. All right, we're going to take another break. And when we come back, if you will share one final tip or piece of advice you'd like to offer new and expectant parents. Okay, we'll be right back.
Ryan Reynolds here from Mint Mobile with a message for everyone paying big wireless way too much. Please, for the love of everything good in this world, stop. With Mint, you can get premium wireless for just $15 a month. Of course, if you enjoy overpaying, no judgments, but that's weird. Okay, one judgment. Anyway, give it a try at mintmobile.com/switch.
Upfront payment of $45 for 3-month plan, equivalent to $15 per month required. Intro rate first 3 months only, then full price plan options available. Taxes and fees extra. See full terms at mintmobile.com.
Okay, we're back. So you have so many hats you wear. You're a doula, you're a child birth educator, you're a parent, you're a therapist. So I'm very curious where we're going with this. So what is your one final tip or piece of advice you'd like to offer?
Oh man, because I do wear so many hats, that is a very difficult question for me. But I think what we just talked about, what is most important during this perinatal journey for anyone is finding the right team. And as team, I mean, I want you thinking mental, I want you thinking and physical as well. So mental, physical, emotional, have your team ready for that. Interviewing your OB, knowing that just because you've been seeing this OB for 10 years, it's okay to find another OB during your pregnancy. They can be the best gynecologist and you may want another obstetrician, right? So doing your research and doing your homework there, finding those complementary health approaches that are going to help you, like you just said, Deb, stay balanced for both your mind and your body. And when your team comes together, I just think that you just are so much more prepared and so much more able to learn more about yourself and do your best to enjoy that journey of pregnancy. Do your best to enjoy that postpartum journey because sometimes it may feel long, but it's very short. I'm already seeing it with my 9-month-old. I'm like, I just had you last month. Like, how are you 9 months already? And so, and I will say this as well. My first journey, perinatal journey, was full of anxiety and unknowns, right? And I don't know if I would say I thoroughly enjoyed it because I was doing my best to just figure things out.
Mm-hmm.
One of my goals with Alex, or we call her Ellie, has been I just want to enjoy every moment. And what I found is that I can enjoy every moment because I have built such an amazing team. From my lactation consultant all the way down to, her pediatrician, making sure that I'm staying balanced with my own, chiropractic care and prenatal postpartum massages. Like, my team has been amazing, and this has been a completely different perinatal journey for me. And this is what I want for all moms. So that's my biggest tip, is to find your team, know who your team is, and lean into their support.
That's a great tip. And also, I'm so happy for you that this time is different and then you're in a different mental space. So
Absolutely.
I'm happy for you. That's so wonderful to hear. Where can people find your work?
Okay, so I'm mostly on Instagram. So I am your perinatal BFF on Instagram, and we have been working very hard behind the scenes to start this community for moms. All the work that I've done has definitely, like you said, I wear a lot of hats, but it's purposefully. I am a know-it-all. I do like to know it all because I like to be able to answer questions and give moms the right resources, to go to. And so we're actually working on an online community right now. I am announcing it on Monday because that will be year 4 for us. For me, it's covered. And I'm very excited. We will be having a community, Deb, where moms, birthing people can just come and be. That is my biggest goal, because you may know, Facebook groups can be great, and Facebook groups can also cause a lot of moms to be in the therapy room, right? And so YouTube is wonderful, but if you click on the right video, the next video may not be the best. And so my goal is, I'm always encouraging moms to find positive things to watch, right? But that can be very hard if positive things are not in one area. Mm-hmm. And so that is this community that I'm building. We will have small groups in this community where we will have the birth debriefing happening. I will have 8-week coaching sessions for prenatal moms, postpartum moms. I will have a miscarriage group, support group that's going to be free for anybody in the community, because that's definitely near and dear to my own heart, as I as well have been through a miscarriage, and finding support can, be tough. So that is one of my free offerings in this online community, is that we will have a space for those who are going through tough times with loss, and a monthly meetup where we can just hang out and talk about, the perinatal journey, and just have a collective space where we are able to share. And honestly, my vision is able to be actually used in one spot. And so that is going to be announced on Monday. So you got to hear first.
That's amazing. All right. So this is not going to be released before Monday. So make sure you give me the link.
Yes. So wonderful. So the space is through Mighty, and it's going to, the space is called Covered Trauma. And it's already linked on my Instagram. And so if you go to, your perinatal BFF, it's already there where you can join into this space, and have a space for your entire perinatal journey, not just pregnancy, not just postpartum, but we're hanging out for a couple years together if you need that support.
Oh, I absolutely love that. All right. So make sure that I have the link, because this is coming out, my guess is April or May. So
perfect. I will get you the link.
I love that. Oh, this has been so much fun talking to you. I know it's kind of like a heavy topic, but you are so warm and welcoming that you created such a soft space to dive into this really intense information. So thank you for your approach, and thank you for the work you do.
Yes, and thank you for inviting me.
Absolutely.
This has been an episode of Yoga Birth Babies, produced by Prenatal Yoga Center. You can catch us on Facebook, Twitter, Instagram, and Periscope. I'm Deb Flaschenberg. Thanks for listening.